Welcome to 6ABC's Weekend Extra, paid for by Mainline Health. Here's Jessica Boynton.
As of right now, the FDA has authorized 3 COVID-19 vaccines for emergency use. More people are qualifying for vaccination every day, but many are still skeptical about the vaccines and wonder if they're safe. We're here today with Dr. Gilbert, an infectious disease physician at Mainline Health. He's going to address some of the most common questions our viewers have about the COVID-19 vaccine. Welcome, Dr. Gilbert. Thank you so much for being here with us today.
Oh, thank you for having me.
So we're going to get right to the burning questions. Can someone get COVID-19 from the vaccine?
No, you cannot get COVID-19 from the vaccine. These vaccines are not live vaccines, and therefore one cannot get COVID infection from the vaccine.
Okay, so the vaccine was developed really quickly, and I think that's probably a little bit of where some people are a little nervous about it. How do people know that it's safe?
So excellent question. You have to remember that these vaccines are closely monitored by an independent safety monitoring board, and the clinical data is looked at vigorously by specialists in the field and are watched very closely for any side effects that may occur or any adverse outcomes from the vaccines. And between the 3 vaccines, it's actually been studied now in over 100,000 people, which is actually one of the biggest vaccine trials in all of U.S. history.
Wow. So what about side effects? I think a lot of people are nervous about getting sick. Will everyone experience side effects?
So side effects in these vaccines are very typical of any side effect that you may see from, for example, a flu vaccine. And they were primarily mild to moderate in the clinical studies. And what are they specifically? People have complained of headache and muscle aches, and they may develop a slight temperature or fever, or pain at the injection site. And those are all fairly common side effects. But that just means that your immune system is actually forming an appropriate immune response to the vaccine. What happens if you don't develop any reaction? Do you actually respond to the vaccine? I get that question all the time. Just because you didn't have a reaction doesn't mean you didn't respond to the vaccine as well. So remember that the side effects tend to be mild, and they can be treated locally. And if you have any concern, you just should call your healthcare professional.
Okay, what about a pregnant woman? Can she get the vaccine?
So that's another excellent question. It's very important for the pregnant females as well to discuss with their healthcare providers about getting this vaccination.
Wow, all great information. I hope everybody stays and watches this Weekend Extra. They all need to. Dr. Gilbert, thanks so much for being here with us today.
No, thanks for having me.
6ABC and Mainline Health are proud partners of Well Ahead Philly, your source for health information. You can learn more at wellaheadphilly.com. Thanks so much for watching and have a great day.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.